often heard saying that a picture is worth 1,000 words and that a model is worth 1,000 pictures. This technology, it's really all about the patient. 3D printing has changed what we can do for them and how we do it. It's opened up new avenues of treatment that weren't possible before. And it all started almost 20 years ago. The first case that led us to start down the road of 3D printing was the conjoined twins. So we had a set of girls connected at the abdomen and chest. The surgeon and the radiologist would be working to try and understand the anatomy, because eventually you're going to have to try and separate them. Do they share a liver? Do they share intestines? So one of the surgeons said, can we make a physical copy of their liver? And they said, well, why don't we 3D print it? So the first one we did, we outsourced, and it came back not looking like a liver. So we worked with the Department of Engineering to create some of the first models that were 3D printed. And it was the first time where a group of surgeons could hold a patient's liver in their hands outside the body. There were multiple surgeons from different subspecialties that had to talk about what they were going to do, and they used the model as a vehicle of communication in a way that you just can't from a 2D picture. You now have this new tool in your toolbox. Our mission is to provide the best quality care. There are a whole host of patients that come with really complex problems that 3D printing helps solve. That 3D printed liver was the catalyst of what we've become today.
The 3D printing lab used to be a single room in a closet-like space, and now it's this beautiful 6th floor of the hospital. It's really almost surreal. You walk in and whole models of the thorax with the heart and all the blood vessels are being spun out.
We're lucky to have one of the world's best 3D printing facilities that we speak about as the point of care, so meaning at the point of care of the patient. You're doing this at the hospital. And this is, I think, unique to the Mayo Clinic.
The 3D printing lab, it's open in the hospital, so it's not on an off-site. As a surgeon, I walk up there between cases. I walk up there during rounds to check in on things.
So you can see that there's a large tumor. You can see how intimately the vessels are draped over the front of it?
Right, that's going to be the biggest problem for us surgically to take this out is going to be the vessels. So what do we see about the relationship of the aorta and the cava?
90% of every patient that comes to Mayo Clinic will have some form of radiologic scan. Of that one scan, there might be 13,000 images. 13,000 images in 4 different phases, looking at arteries, veins, tumor, ureter, all of this information. An engineer is going to have to segment out every slice in order to make a 3D printed model. And we probably do about 3,000 models per year. Each one of these printer rooms does something different. So this printer does powder-based printing. So each layer was being laid down layer by layer. A new layer of powder was coming in, and then it was dropping down and doing it over and over again until you get a 3-dimensional object. These printers are another technology. If you can imagine like a hot glue gun making a circle and then making another circle and then making another circle, you could start to build a 3D object. This is another print technology. We use this to make full color anatomic models. So if we want something like that's full color, that has multiple small parts like this, that has multiple small vessels, like these vessels of the pulmonary artery, or if we want to build training modules like this pulmonary tree with all the lymph nodes around it. My goal is to help aid in the suffering of another human being. And this technology can provide better care to a greater number of people.
It would be great if we could remove part of the skull in the back.
Yeah.
To show better the tumor.
Let's do that.
Oh, yes. And I like that you remove the first cervical vertebrae, because that's like the approach that we're gonna talk to the patient about. So that's really helpful. Each tumor is different. For instance, we can see that this is really in the center of the base of the skull. So this is a tumor that is difficult to access. There's possibility of an approach through the nose, but there's also possibility of an approach through the side. That was important to decide what was best for the patient. I could touch and feel in real size what the tumor and the anatomy look like. And that has really changed my practice.
Here is the 3D model. You can see the tumor is coming towards the front of their face.
Our planning is much better. Three-dimensional modeling has taken all the guesswork out of it, and it's made the process far more precise. These are really long operations. We used to have to take out the tumor, clear our margins, envision the defect, measure the hole, harvest the fibula, take that up, cut it, see if it fit. With this precise modeling, one of us will be up taking out the tumor, the other one will be taking out the fibula, actually cut that in place while the leg's still hooked up, these blood vessels are still hooked up, so that as soon as the tumor's out, this is ready to go. Then that patient can spend several hours less on the operating table and get a lot less IV fluid, and that translates into a lot quicker recovery.
Every model is a case, but it's not just a case. It's a patient with a family. What were their fears and their anxieties?
A model really helps us understand exactly where the tumor is. It's like a tremendous three-dimensional roadmap. And this allows Dr. Price and I to make these really precise cuts.
So this is how we're going to put that back together.
Oh, okay.
So this is, you know, your leg bone there that we're going to cut and bend into shape to rebuild your jawbone, and then we're going to put 3 implants in there so we can get teeth in there.
Yeah.
So we can get you chewing again.
Yeah, that sounded like a really poor deal, though. Pulling out 7 and won't give me 3 back.
There are tremendous uncertainties for patients, and that leads to anxieties. Many of the patients who are referred to us have very rare tumors, and they may not have a good understanding of it. The ability to sit down with them with a model that shows their exact anatomy can be very valuable to build trust and build comfort as they move forward with the treatment of a rare tumor.
Could I see the finished product?
Oh, yeah.
Yeah. So that's his leg bone there.
Okay.
Cut it.
It's one thing to show them a CT scan or a diagram, but it's really another level of communication when they see their own 3D printed model. We can actually tell them, this is what we're going to do for you. These are the bones that we have to move. This is the symmetry we're trying to establish, and it brings a lot of clarity for the patient.
Well, that model is amazing to be able to see.
Yeah, isn't that incredible?
Hi, how are you, Olive? Every time I open a door and go into a clinic room, there's a family waiting for me that has a very eager expectation that I'm going to be able to help their child. It does look like your curve has progressed a little bit over the last few months, so I'm really glad we have this scheduled. It's getting to be the kind of scoliosis that could cause problems down the road later in life. I tell my patients Mayo has 1 or more of everything, and that really allows us to leverage the knowledge and the techniques and the technology to do surgeries that are not possible elsewhere. Mayo has really been a leader nationally in this field. While you're asleep, we make an incision over your back, and the incision is kind of something like this, from the top to the bottom. Move the muscles out of the way, place rods and screws over the back, and then we connect the screws to the rods and pull the spine into a straighter position. We're dealing with unique patients that have a deformity that's probably different from every other child in the world. Having a customized model is critical. At the end of the procedure, we roughen up the bone, and that kind of tricks the body into thinking that it had a fracture, and it kind of sets off this whole cascade of bone healing. And then all the areas that are spanned by the rods heal into a solid sheet of bone.
3D modeling is incredibly helpful in operating on young children, because on a scan, every CT scan looks the same size, but in real life, the anatomy for children is very different. 3D printed model in a child allows you to truly visualize the anatomy that you'll be dealing with.
As we expanded our 3D printing clinical uses, surgeons came to us that wanted simulation tools. It was clear that we could only get to a certain level of fidelity. And I thought, we need someone who has this skill set, that's making special effects props for the industry, that knows urethane casting, silicone molding, silicone painting, live casting. There's no job description in a 70,000 employee organization that says special effects engineer. And we were just lucky enough to have Christian Hansen apply, who had worked in the special effects industry. Ever since then, we've been making these bespoke custom simulators.
I've always been into special effects, makeup effects since high school. You know, got into sculpture, I got some books on how to do masks and prosthetic makeup and things like that. I had plastic skulls when I was growing up, and I would just stare at them. You know, my heart's always been in the makeup effects world. That's what I've always really had a passion for. Try to put as much detail, as much realism. I'm constantly pushing to capture, you know, tissue quality, the look of fat and muscle. This model is a good example of where we use full-color 3D printing and digital painting to replicate the realistic surface of an internal thoracic cavity. It's a combination of the visual realism and then also trying to get the way that the tissue is going to move and feel. Most of this approach isn't really a standardized way of building a model, so we're kind of making it up as we go to push the limits of what's possible.
This is a silicone molded skin that sits inside of a 3D printed base. The outside of this is what the practicing surgeon's going to see. This is going to be put together like that, and then it's going to be inside that cavity. So what the surgeon's going to see is this is going to be all toweled off. So then the surgeon will reach into the chest cavity and have to stop bleeding or other pulmonary trauma that we've built this for.
We've got a task trainer here for sewing two blood vessels together. So we have to make sure that we do this perfectly when we do it in the operating room. And the best way to do that is to have lots of experience, and we can get a ton of experience without any risk practicing these procedures.
We run a simulation program every year with our incoming residents. A surgeon will practice and perfect surgeries maybe 100 times before they actually ever perform that surgery on a human body.
I'd give myself a C+ because we got that little kink over here. I'd give you an A+ for each of these being pretty equal length sutures. We have a patient coming up who has a tumor that's replaced most of his upper jaw. And we have to remove that tumor and therefore remove half of his upper jaw. And we rebuild that with bone from the leg. So we're going to take his leg bone and fold that into the shape of his upper jaw bone. And then we're going to bring that nutrition to that bone by sewing the artery from the leg to an artery in the neck. And this is a task trainer that simulates that portion of the procedure, which is critical to the success.
envision 3D printing being more and more common. This is going to help advance science. This is going to help advance neurosurgery. It's a better result, and that's what we all want. We want the best result for our patients. This is the model that we looked at before the surgery, and this is the tumor that we removed.
Makes it easier to see exactly what it looks like. It's hard to imagine it just looking at the MRI, so yeah, it's really helpful to see that. The model was pretty impressive to be able to see everything and where the tumor was, how big it was. I think it really helped put it into perspective. Looking at the model definitely made it feel more real.
So this is the tumor that we saw in the model. And here we see after the tumor resection how your spinal cord and the bottom of your brain really expanded.
I'm feeling pretty good, actually. Yeah, surprisingly pretty good. On the road to recovery, I definitely through the worst part, I think. Getting that tumor out was key, and now it's just recovering from here.
Since that set of conjoined twins, it's hard to believe how much time has passed and how far we've come. We're growing at an exponential rate. At some point, you need more space, you need more staff. And we built another 3D printing center at Jacksonville. We've expanded our operation to drive care. Now, another part of the country are doing the same exact thing that we're doing in Rochester.
This is the anatomic modeling unit at Mayo Clinic in Florida. We work with physicians on campus, surgeons on campus, radiologists on campus. This is an evolving technology. There are not very many places around the country doing this.
You can see how severe the scoliosis is. This patient has previously undergone a fusion surgery, and so you can see this solid bone that has grown back here. Being able to look at things that we're not able to see just looking at traditional imaging gives you that comfort level to tackle more complex cases. So day-to-day functions.
The better service to the patient, the better care delivered to the patient as a result of this technology is immeasurable. And when you think about academic medicine, you think about how we're educating the next generations of surgeons. And so this technology isn't just about 3D printing, it's about three-dimensional assessment and three-dimensional tools. There's a ton that can be done with education in virtual space.
So virtual reality, it allows you to build educational spaces. We can build museum environments or OR environments, and that allows people to be trained in all of these different types of surgical approaches. Skull-based neurosurgery is a really steep learning curve. Traditionally, if you want to learn from Dr. Paracella or any of the skull-based surgeons, you have to physically be near them. And what we're creating at Mayo Clinic are immersive environments to get you up to speed faster.
Medicine and surgery is an apprenticeship art, and you spend years doing it by repetition over and over. Think of how that educational process can be accelerated just by all of the virtual practice that you could do. I think it's going to revolutionize the way we do surgical education.
When you went and got that CT scan, all that gave us images of your body one slice at a time. So what we've done is we've taken all those slices and we've created a 3D model. So this is an image of you. That's your arms, that's your skeleton. And if you look back over your shoulder, you see where that green thing is where the tumor is.
VR and AR is really the future of surgery, and artificial intelligence is going to play a big role.
This is a young woman who is 13 years old who has a progressive curvature in her spine, which is really progressing fast over 4 months. And typically, in order to be able to make a model of this, a technologist would have to level by level hand color in each bone. But now that we have this AI algorithm, Not only can it segment the bones, it can auto-label which bone it is. Now we can go from a scan to this in about 4 minutes. The next step beyond the segmentation, beyond making the 3D models faster, are those predictive algorithms.
Let's say someone had an eye socket fracture on both sides, a case where everything is broken. The AI can actually tell you, this is what this should look like. This is the best anatomic alignment of the fracture you're dealing with. Then this can be 3D printed. This is going to be really revolutionary for complex facial reconstruction.
The question is, can the next advance be what's called bioprinting? Instead of just an implant, can we attach antibiotics to that implant? Can we attach chemotherapy to an implant? And I think that very well will be our next frontier.
It's a tool that each surgeon that's used it has come back and said, this allowed me to do things in a way that I couldn't do before. Part of my mission in the last 10 years is to kind of be an evangelist of 3D printing in medicine, because most patients will never come to Mayo Clinic. And unless we're helping people around the world, we're not impacting patients in the way that we feel this technology can. The mission of Mayo Clinic is the needs of the patient come first. This technology supports the mission. We're doing what's best for the patient. It's not about us as surgeons, as physicians, as technologists, as innovators, that it's all for the patient.